One of the most important lessons on the course is avoiding failure in all aspects of dentistry. So the first of the presentations will deal with avoiding failure in essentially restorative aesthetic and cosmetic dentistry by undertaking proper smile evaluation and also risk-based aesthetic diagnosis. Once we have established the length and width of our central incisor, we then have rules called golden proportions, which then establish the apparent width of our central, the apparent width of our lateral, and the apparent width of our canine tooth. Now, golden proportions within dentistry are apparent widths, they're not actual widths, because the lateral and the canine are both on a curve. And golden proportions is a kind of classic aesthetic harmony, and it's used quite a lot within car design and factors such as this. Often measured with golden proportion calipers that you can see in the middle of the slide, but there are other ways of assessing it. And here are our proportions, essentially 1.6, 1 for the lateral, and then 0.6 for the canine. And bear in mind that golden proportions, there are 2 or 3 versions of it, but essentially what it means is that our central stays dominant in the smile. The dominance isn't on the lateral and it isn't on the canine. If you increase the proportions on the canine, it looks bulky. And again, if you increase the proportions on the central, the tooth then takes over from the central in terms of dominance.